Hi friends, this is Shri Vidya. I welcome you all to my channel on Cardio Essentials. Today we'll be discussing about angioplasty and stent placement in the heart. So, we might have heard it many times, angioplasty, what is this procedure? Why does a cardiologist do this? When is it required, So, we might be wondering, what is this procedure? This is angioplasty is basically done to what happens is, in this procedure, they do open the narrowed or blocked blood vessels, which supplies blood to the heart. And these blood vessels, what are these blood vessels called, which supply blood to the heart? We have been discussing all through our previous channels on that. Those are coronary arteries. So, a coronary artery stent, what is it? We always hear stent, placing a stent in the heart. When too much of spicy food, it can be the sedentary lifestyle, or it can be more, I would say, is the food that we eat. Like I said before, any ailment, be it thyroid, be it diabetes, be it anything, everything can be the basic control can be the diet. And when we go to parties, it's inevitable, the food is very spicy, but we have to keep a check on what we eat, whether it is a party or whether it is a CME meetings like doctors go. We have to keep a check on what we take. There are also salads, fresh salads, and also, even if it is a buffet, you can always go to the chef and order something like what we call it, salty vegetables, those are done in olive oil, which are very healthy diet. I like salty vegetables and salads, veggie salads or fruit salads, which are very good. Now, coming back to the subject. So, a coronary stent is nothing but a small metal mesh-like tube, which expands inside the coronary artery. So often what happens is a stent is placed during or immediately after the angioplasty. So why is it placed? Now you might be getting this question. It's basically done to prevent the artery from closing up again. Just like a drug-eluting stent, it is a drug-eluting stent which has medicine embedded in it that prevents the artery from closing in the long term. So this is a common kind of stent, balloon angioplasty, they say. So we might as well be wondering, so what happens is before the angioplasty procedure, the patient will be receiving a pain medication, like we generally do with all the surgeries. Then and also be given medicines that relaxes you, and then blood thinning medicines to prevent blood clot from forming. Then the patient will be laid on a padded table, and we doctors, surgeons, what we do is we'll insert it's a flexible tube called a catheter, that's inserted into the artery. And sometimes the catheter will be placed in your arm or wrist or in the upper leg, groin area, So the patient will be awake during the procedure. And what the doctors will do is they will use a live x-ray like pictures to carefully guide the catheter up to inside the heart and arteries. Then a liquid contrast, it's sometimes called as dye, will be injected into the body to highlight the blood flow through the arteries. That helps the doctor to see if there are any blockages in the blood vessels that's leading to the heart and where exactly is the blockage. Then through this guiding wire is moved into and across the blockage, and a balloon catheter is pushed over the guided wire into the blockage. Then the balloon on the end is blown up, it's inflated. It opens the blocked vessel and restores proper blood flow to the heart. So why the procedure is performed. Many times, like I said, anything that arises, you have to ask, put a question as why. So arteries can become narrowed or blocked by deposits called plaque. So what is this plaque? We always come across this. Plaque is nothing but it's made up of fat and cholesterol that builds up in the artery wall slowly. So, and what happens is this condition suddenly, slowly, it starts hardening of the arteries. What is this called? Atherosclerosis. So, this blockage, this is done, angioplasty is basically used to treat the blockage in the coronary artery during and after a heart attack. So, blockage or narrowing of one or more arteries, coronary arteries, may lead to poor heart function, or it might even result in a heart failure. So narrowing, what happens is it reduces the blood flow that causes persistent chest pain, and what it's called angina, that medicines do not control. It cannot be controlled by medicines. So not every blockage can or needs to be treated with angioplasty. It depends on the severity of the cases. Some people have several blockages or blockages in certain locations, may need coronary bypass surgery. CABG, some blockages are treated with medical therapy rather than interventional procedure. So when we are talking about angioplasty, that is generally a very safe method for doing this. So you might be thinking, what are the risks associated with angioplasty or stent placement? There might be some allergic reaction to the drug used in the drug-eluting stent, or the stent material. You have to be very careful how much it is good, and the extra dye. These can cause some kind of allergies, and bleeding or clotting in the area where the catheter is inserted. Then blood clot formation, which is very common and it should be very cautiously monitored. Actually, there are regular appointments taken with the cardiologist after the stent placement, which should not be avoided. Okay, what will happen anyway? I'm taking the medications, right? No need. And let me take probably next week. Please do not do that. Please don't neglect. Health neglected, death is one point, and leading a very painful life is the other point. So why not prevent being painful, taking the pain? Knowingly one should not take the pain. Knowingly, sorry to use the word, but many a time people are ignorant, they postpone things. Oh, what, one time if I eat spicy food, so what? One time might cause many times. One time, they say, there is a saying, it's not related to that, but I'm using in context with this. A spark neglected burns the house. Same way, diet neglected will give you a lot of risk, be it your thyroid, be it diabetes, be it stent placement, anything. So clogging of inside the heart, instant restenosis, this can be threatening, life-threatening, or it can lead to the damage to a heart valve or blood vessel, heart attack. It can also sometimes lead to kidney failure. When after having a stent, you have to be very careful. So already people who have kidney problems, we should be double careful. Then you will be talking about irregular heartbeat, arrhythmias, or stroke. These are all the risks associated after the stent placement if not taken care. So regular appointments, never miss a cardiac appointment, and thoroughly follow what has been prescribed and guided through and a diet chart. Please don't feel lazy. If you cannot do it, appoint a nurse or somebody at not only at the hospital, even at home you have kind of a nurse services who can take care of your diet. But when I'm talking about nurse services, you have to be very careful. Once what happened is a medication, very crucial medication, had to be given, and the nurse actually in a hospital, I don't want to name it, she slept during the medication time. It had to be given around 11:30 at night, which was missed, because of which the patient had undergone lot of pain and doctors had undergone lot of stress. So when you are having somebody carrying like a nurse care or something, either at the hospital or at home, you have to be very careful in what is being administered. If you can do it yourself, that is the best thing. You have to remember, take out time. Even if you are a doctor, nothing wrong. You have patients, you have calls, you have hospital, everything is important. But what is most important is your health. Only if you are healthy, only if you are keeping brisk, if you are doing good, you'll be able to help your patients, right or wrong. So why not? The basis of this is your good health. So why not attend to that? Am I wrong? Please? No, right? Okay. So angioplasty is often performed when you go to hospital or a ER for chest pain or after a heart attack. What they do is they get you admitted in the hospital. They take your ECG, echo, do all the tests, and then they decide whether to go in for that. So prior to that, the primary care physician or the attending physician, I would say, or the ER physician, please, they have to know what medications are being currently given to you, what are you have been taken, and what are the ailments you have, allergies if any. So what happens is, for some tests you will be asked not to drink or eat anything 6 to 8 hours before the test, or sometimes take the medicines your medical practitioner has told you with a small sip of water. So there might be, for the procedure, there might be some instructions given. Follow the instructions very carefully. So tell your physician if you are allergic to anything, or you had a bad reaction to contrast material or iodine in the past. You are taking something like a sildenafil, that is Viagra, or similar medicines. I mean, it's age related, like again I said. Or you are or might be pregnant. So there are so many factors to be considered, and your physician should be knowing it completely. He should have a complete history of you before he proceeds on. So today I'm going to end up the video right here, and wishing you all a very healthy, long life, and stay tuned for the next video, wherein we'll be discussing post care. What is after the post care, after stent placement, what you need to do. So how many days of stay in the hospital, and do's and don'ts. So if you like my video, please do put a like. Thank you and God bless.